Welcome to the Nursing and Midwifery Sustainability Network event. For this month, we're delighted to have Dr. Marion Lynch, who is going to join us today. Just a reminder before I introduce Marion that we run the sessions on the last Thursday of the month at 12:30 till 1:30, and please do encourage your colleagues to join us. As we're always trying to improve our numbers, so yeah, share the invites far and wide. So I'd like to introduce Dr. Marion Lynch, who is going to speak today. Marion has a very extensive CV. In summary, Marion is a global health consultant. She's a nurse and a specialist in how arts and delivering the Sustainable Development Goals are linked. She leads on the Art of Nursing social movement and webinars, and has written extensively on creative health, public health, and the future of nurses. In both of these areas. She's a trustee of the Foundation of Nursing Studies and has been representing the FoNS work for the Green Nursing Challenge. Without further ado, I would like to hand over to Marion, and I will pull up the slides. Hello and welcome to everybody that's just joined us. Okay, Marion, just give me a moment.
Hello, everybody. I see familiar faces, which is always gratifying and panicking. It's like having your family in the room, isn't it? Oh my God. So lovely to see you all, and thank you so much for the invitation. And I'm here because Angela and I bonded over how the arts are helping nurses harness and deliver the Sustainable Development Goals. That's not me.
No, I know. I've just realised I put up the wrong. Can you see that now? Is
Oh, we can't hear you, Marion. I think you're accidentally muted.
Oh.
Angie, you just need to press, if you put present down the bottom, we can just see your screen. So if you press enable editing, and then down the bottom on the right hand side, you should be able to. We can't hear Marion at the moment, though. That's if something's happening.
Sorry. Let me just end the show again and start. Oh, enable editing. Right. Okay.
Perfect. And then
right.
Hopefully we can hear Marion again, because I'm looking forward to this. No,
we can't hear you, Marion.
No, can't hear you. Sorry. Can you hear us? I'm sure. Yeah, you can. Good. Okay.
Yeah. Oh.
You think you
could leave and come back in?
And come in. Yeah.
Yeah. Marion, I wonder if it's worthwhile you leaving and joining again. See if that helps.
Lovely. It was lovely to see so many familiar faces. Yes. Thank you for joining. Lots of exciting work going on in the nursing midwifery field at the moment. So, and I know many of you are involved in it as well. So, and a big shout to Anna, who I'm sure probably will share at the end of today a bit about what she's been working on. And thank you, Amanda, for your support as well. Great to have you on board. All feels a bit real now, isn't it? About to launch. So those of you that aren't aware, we're just about to launch our three-tiered, I'm sure you've probably heard about it already, but just in case, our three-tiered nursing and midwifery programme, which is designed to really accelerate nurses getting involved in sustainable healthcare. And Anna is amazingly leading it for us at CSH. I think Marion's back now, so I'll stop filling.
Can you hear me on now?
We can.
Yes.
Right.
She's back.
Can you hear my heart? Can you hear my heart?
Okay, I'll right. Is my screen sharing properly now?
Not yet.
This is why I send these slides in as well. Okay.
Right, try again.
If it goes wrong, I'll do the slides.
Yeah. This was supposed to be an easy way. Is that? Can you see it now?
There you go. Yep. And then just down the bottom, share full screen, and then we can see them properly. That'll be great. Lovely.
Just say you can still hear me.
Yep. Yes, we can. Hooray!
Right.
You can relax now.
So I'm just going to take a slurp of decaf. Hello, everybody, and welcome to this 35 minutes where I'm going to start to share with you how and why the arts are helping nurses. And Angela and I joined together through some art ways of engaging with young people. I'm going to practice what I preach and teach. So the first step is to imagine a picture. Now, this isn't a chart or an OBS chart like nursing, it's a mind picture. And in your minds, I want you to imagine two worlds. One world is a child walking to school with clean air, lungs filled with air. She's laughing, she runs and trips over a tree root because the place is full of tree roots. They're pushing up through the pavement. She goes home that night, breathes easy, dreams big. In another world, same child, same age, except this time she's walking past the broken fences in Kabwe in Zambia, the most toxic town on the planet. The dust is in her lungs, it isn't air, it's poison. And the life expectancy is written in years for her, not decades. And both of these worlds exist right now at the same time. And as nurses, we live in both. And this is why I'm sort of focusing this session called Parallel Worlds. Because if you're a nurse, you feel this every single day. Because we're not just nursing people anymore, we're nursing the planet, and we're doing this as a system, and an inner system that often shuts us up and shuts us out of the big conversations. So when I'm speaking with nurses about climate activism and artivism, many people say, oh, why bother? Why really? You know, it's too big, it's too hard, why bother? So that's why I'm here now, to answer that why bother, but also to show you how people are bothering as well using the arts. So Angela, can we go to the next one, please? So firstly, I share with you a picture. Here I am. I'm the one in the shortest shorts because avoiding damp clothes was more important than keeping my dignity at this moment. And I'm here in New York during the United Nations General Assembly in 2024. So I did speak at the United Nations, and I'm very glad I'm not there this time. But I also stood here. And instead of speaking with the great and the good, I'm standing here in the Hudson River, in the bricks and the mud. And you may well ask why. Well, I'll tell you. The artist Susan Sandy created this great participatory art called 36.5. And the idea is very simple and very effective. The physical and emotional elements you have when you're taking part in this art changes how you connect with the planet. So Susan goes to a tidal estuary, places where land and sea are constantly negotiating with each other, and she stands alone and still in the water for the entire tidal cycle. That's 12 to 13 hours. She begins with the water at her ankles, and then slowly, as it does every day, the tide rises up to her legs, her waist, her chest, and at times she's almost swallowed by the water with only her red hat above the water. And then as the water goes back, she's there still, standing still. And the audience to this art isn't in seats or looking at some great gallery. They're gathered at the shorelines, on the bridges, even joining in a live stream around the world. Yes, live stream art for 12 hours. They witness her body against the body of the ocean, and they talk about it, and they talk about the rising tide and the rising temperatures. And such climate activism leads to action because people notice what's happening. And I should know because I stood there. I only stood there until the Staten Island ferry wash knocked me over, and I did lose all my dignity, even with the shortest shorts. But it reminded me of when I'm teaching nursing, and we teach slow learning in nursing skills. And I had to slow down and stay with what I could see and feel, and it changed me. And this is the way that we use art as a mirror. to what's happening across the world, rising tides, taking away land and livelihoods. And it made me think of the midwives in Pakistan who I'd heard were still providing care when the floods took away their buildings because babies still had to be born and people still needed nursing. So as we as nurses are standing on this tide of climate change, why do we bother? Why do we face it as personable and vulnerable people? Or do we look away because it's not our problem? And I believe it is our problem. Some powerful people only yesterday at the UN were saying it's not a problem. And this is why the work of artists like Susan Sandy matters for us nurses. We know, and there's 10 million of us, and if we speak loudly, we can show why it matters. We can know that the tide of trouble and against climate change is rising against us. And what being a nurse is actually all about is being connected to an individual. And we need to now apply those skills to being connected to the planet. Because resilient isn't about being knocked over by the ferry, it's about getting up again and waiting for that tide to shift, but being part of the shift. So Sandy's work is participatory art performance, what happens on the shores of the world. And nursing can be participatory art performance too. It always takes at least two. And the impact of our work on other people is about building their presence always, having patience and the courage to show things and say things in a different way. I want to sort of share with you some more examples of this now so that we notice that our own health can't be separated from the planet's health. Like even standing in water, you have to balance, and the biology makes you realize that you're part of something else as well. So this is what's happening in the United Nations beyond the other things that are being said about today. Can you show the next one, please, Angela? So in the United Nations, there are some art programs happening, and it's called Parallel Realities. And this is why I'm giving you those parallel pictures in your head. So Turkish artist Gura Galunzes is using his artwork to show parallel situations, children and people of the same age, but in different situations. And his art is showing about the data that's going on and that we're gathering, but also what makes us human. And this is art activism in its best way. The pictures that you can't look away from, the stories that you can't get away from. And for nursing, I think it's the social justice element that we must not now shy away from. So let me take you through some of this gallery. The next one, please. We talk about a wonderful world. Well, it's a bit ironic, isn't it? When we know 9 out of 10 people breathe polluted air, which causes an estimated 7 million premature deaths every year and threatens our economic and security. When I worked in Zambia, I went to Kibwe, the most toxic town in the planet, and I'm an asthmatic. And what I noticed there was the nurses who were undertaking quality improvement programs, but working with a generation that was already damaged from lead poisoning from pre-birth and breathing it after birth. And they're working with a whole generation whose needs are more than can only be addressed through health. Imagine your whole town having special learning difficulties. Imagine how that is because of the way that the world is going. So the nurse's role in actually starting to address climate change is more than the plastics that are in the space. There's the pollution in our air as well, and nurses are doing their best to manage the impact of this. So Kibwe is one place, and it was dusty and dark, and I did have some trouble breathing. But let me take you to another space, a place where I did not have trouble breathing at all. Let me take you from land to sea, but a different problem as well. So can I have the next one, please? Imagine now, rather than that dust in your air, you lift your head, shoulders back, take a big, deep breath because you have a horizon ahead of you and enough air and space and water around you to be able to feel much calmer, no wash of ferries, and suddenly you see a rainbow. Well, this is the story I had when I was challenged with gender equity and the planet. So take the parallel worlds of land and sea. I want you to imagine 3 women sailing across the Atlantic. This wasn't a yacht club fantasy. There were no cocktails involved. This was real women, real sailors, real waves, real risks. and this was me. In 2024, sailing from Cape Verde to Panama, most of the crew were men. So there we were, 3 women at sea, experiencing some issues to do with misogyny, and reflecting that gender equity in leadership is going to take 183 years, and probably we decided more at sea. And we wondered if the planet was going to last that long as we looked at some of the issues that we were looking at in the ocean health. And then this rainbow appeared. And this rainbow, not Instagram rainbow, it was a real rainbow, a tiny, tiny rainbow that appeared. And it just made us think of the world and thinking it was whispering, even the smallest can rise. Next slide, please. So in the moment of 3 women in the middle of nowhere, and I've had enough, we'd had enough, we decided that we were going to write a book about the issues for the planet, but written in a children's way that talked about this tiny rainbow. And the book Tiny Rainbow's Birthday is a way of showing how the planet helps us live and breathe, and the winds, clouds and sea and sun, etc. come together. And it's not a very subtle way of talking about gender equity, as the sun is working with the sky to try and make the clouds, who have all gathered together to stop rainbow growing, to get out of the way and share the sky. So if you're interested in this book, I'm doing a webinar on it on the 29th of September, but it's another way of using the arts to help us start to get the message through about some of the issues and opportunities that engaging with nature can bring, but also subtly some of the challenges. And this builds on Angela's work with nursery rhymes that you might have heard of as before. So next slide, please. Why do I bother with this? Why does it matter about gender equity? You know, people say to me, oh, surely it's not a problem now. But we know that if women were treated equally, we could reach our full potential. And today, 1 in 3 women and girls suffer physical and sexual violence. And equity is not a privilege, it's a human right, even at sea. And nurses know this better than anyone, because we see what inequity does to our bodies and our families and our future. Powerful men in positions of authority say that perhaps we should tough it out during pregnancy, and that pain in pregnancy should not be medicated with very safe medication. So what we need is fairness, dignity and action. And this can be shown through art too, because the powers that are speaking against us have power more than we have as individually. So we need to use the arts. So the next one, please. So here's an example of how art have worked with artists to show this burden of the white man holds. It's difficult, isn't it? So this is called White Man's Burden, and it's a painting by Madalena Kay that was part of my Global Health 50/50 work a couple of years ago. And every day we are witnessing these unequal burdens. Women are holding up families, holding up health of others while our own health collapses, holding up communities left behind when disaster hits, and patients choose between medicine and food. And these stories need telling in ways that perhaps we could look beyond what is happening in positions of power that talk about climate issues not being true, that look at fossil fuels as monetary powers, and look at actually what's happening to the women of the world within this as well. And this beautiful picture starts to bring that forward and was winner of one of the programs. Next slide, please. So whilst we talk about art and its kind of abstract way of explaining things, I also want to now bring us to nature, because when I work in the arts, it's not about colouring in or colouring in the lines or colouring out of the lines. It's about everything that's not to do with a dominant way of thinking about things, which is the science way, and that includes nature. So a picture from the United Nations today, which is that dual pictures of trees again, and it brings me back to the Kipway Way, where there were no tree roots to trip over. The loss of trees means the loss of our quality of air as well. And within this, other pictures that I use in teaching and in conversations about trees and about the health of the world, make me realise some of the issues that are happening beyond what we can potentially understand with just words. So I'm going to show you 2 images of 2 trees now, because the trees are our allies in health as well. First tree, next one please. This is Doug, Lone Doug. This is a tree from Vancouver Island. This tree would have been worth a fortune. I think it was $75,000 if it had been chopped down along with the other trees that were chopped down. But the forestry people realised that something had to be left standing, and they didn't need to chop this one down as well. They would have got the money, but they didn't need to chop it. So Lone Doug stands there now on Vancouver Island and has become a bit of a pilgrimage space to go to, where people go to recognise the worth of trees and the value of them beyond the physical value. And this image of a tree standing alone is something that can viscerally give us a moment to think about what we do when it's not about the money. The next one, please. Now, here's a tree we lost, the sycamore tree. Sycamore tree is a tree in the UK that was chopped down and has gone now, and had a moment where people would go there for their wedding photographs and was a place to go to, but is now a gap. And legally, the value put on this tree was £5,000, because the only way we could put a value on it was what its wood was worth. And yet it was worth so much more in our society, not just as a tree giving off emissions and saving, but as a place and a kind of pilgrimage and a piece of art to go to. Next one, please. So bringing us up a bit, I want to take you to where trees are actually not chopped down or left alone. And here is a space where trees are starting to be valued and grown and looked after within health spaces. This is the creative health space that Turning Point have. This is a mental health inpatient unit that I was in a few weeks ago, and their space to build greenery and connection with art and with nature is coming from them. The tree stumps are from the service manager's garden. The trees and the planting that is outside of this shot are all built and created by the people who are inpatients in this unit. So there are ways that we can look beyond the loss of trees or lone trees and actually see that building nature spaces in our health spaces really work, and we know that through our green spaces. So go next slide please. But I want to go back to a quick why bother, because I am a nerd and I do like a bit of data, as well as sitting in lovely under trees with service users talking about how art and nature helps health. And my urgency called here is about the statistics that are going on in the UK. And it's to counter this conversation that climate change isn't happening. So I work with nature people, and here's their message to me and their stats that they wanted to share with you. In the UK, it's going to be as hot in 2050 as it is in Barcelona now. So the trees that we plant in NHS forestry schemes, or that we put down to needing when we're talking about encouraging native planting, is going to be a problem, because they're not going to be able to live. And when I asked about this and the NHS forests and the sort of campaigns for sustainability, the people involved said they're just not listening. They're just planting trees that are going to be dead. So I wanted to bring to you the rise of pests and disease since 1970 as well, because the bugs that we have in the UK in the trees are also rising and changing. And if we don't start to look at developing NHS forests approaches and our sustainability that's going to be beyond native thinking, native trees thinking, we're just going to be planting trees that aren't going to exist. And the forestry people showed me all the dead trees because there is no link up between planting the trees, getting the bid, and then watering them, and then knowing that they're going to last. So that's my why bother bit. to you. So the next bit beyond bugs and Barcelona, then I want to bring in another bit of science. So when I work in the arts and biology, people think it's all going to be a bit arty and othery, and I should be wearing long hair and big earrings or something. But there's so many science elements with it. And I'm just showing you another picture of a tree. This is the fractals. So when we look at fractals, our brain sees patterns and it calms down. Whether it's a cauliflower or a snowflake or trees like this, the neurotransmitters mean that our body starts to heal itself. And the biological studies on this and your brain on art and your brain in health means that if we start to put this kind of imagery into our art and into our hospitals, we start to heal people through the environment. Hospital rooms have done this through their paintings of nature in corridors. What happened is people started to take their chairs into the corridor to sit in nature instead of just rushing through the corridor or sitting on their own in their offices. So the biological and ecological come together, and the environmental also starts to happen. And this is all down to neuroscience. This isn't nerdy, just art stuff. This is actually science stuff as well. So my next one then, please, is the question then is how can the future of nursing be about people and about the planet? And like I say, I'm a nerd, so I do need a framework and an education plan as well. And this is the nerdy bit that it's not mine, is the ecological planetary health. Because if we start to look at this just in a way that we are looking at infrastructure in the usual way of thinking in social determinants of health, I think we're going to be missing out this arts and culture and nature and science element. And somehow I want to bring in the arts into each one of these levels. And hopefully I've shown you some of those aspects or triggered some thinking as we go ahead. But in order to do this, I need to have leverage. And Maggie's here as an associate dean. I used to be an associate dean, so I need to have the education bit as well. So next slide, please. So I'm wondering, and I'm sorry it's small because I was typing at speed, if we can somehow link the Sustainable Development Goals with new competencies in nursing. And when I say competencies, I'm not talking about the minimal way of performing some task. I'm talking about ecological literacy along with my aesthetic literacy that I'm talking about. Some kind of way that we can build this into the future way of looking at nurses. And it's not there yet. We still are talking about nurses being task-based. Someone said to me recently, oh, you're a semi-professional, aren't you? And I had to tell you, I had to hold that sense of presence and stillness very, very, very closely. And this is the issue that we are still facing. So if we can somehow reframe the future of nursing to be beyond that, you're here to help medicine. I was like, oh my God, what century am I in? Oh yes. We can move things on maybe a little way, but we can only do that if we move en masse and loudly, and as women who are no longer going to accept being treated in a way that isn't going to advance our agenda and advance our profession. So here's my call to action for you. Okay, next slide, please. Do something different. Stop being quiet and start to speak up. For the arts people in there, you'll know that that's me with a little moment of arts there. The Stephen Curtis, yes, Love Actually, Notting Hill, 4 Weddings and a Funeral. My work in the arts is to try and engage a bigger picture so that people stop seeing nurses as quite nice angels and lovely, but in the background of every story, of every picture, of every film, performing tasks that are not actually 21st century world. The other person there, that is my hero, Mary Robinson, first Premier and President of Ireland, and now leads the Mary Robinson Foundation, which is about saving the planet, climate. My biggest lesson was learned from her last year when we sat in the United Nations and they were developing the Pact for the Future. She had spent 3 years ensuring that fossil fuel activism was undone, where we needed climate support and climate change, with other elders, presidents of Brazil, all this, really powerful people. And at the last moment, within the last 48 hours of this Pact for the Future, which is kind of the world plan of what we're going to do, the fossil fuel lobby won, and maintaining work and maintaining fossil fuel work got back into the pact, and she was undone. These are prime ministers and presidents. And she took a big breath and she just said, we go again. And my lesson learned was when even women like that, who hold the world in their hand with power, are undone by lobbying of climate action, climate harmful ways. And she has the grace to go, we go again. I think as nurses, we can go again. So in the middle, that's me. That's my sustainable development work, where we just say, come on, let's do something different. Let's go again. So my ask to you right now then is going to be to do 3 things and to spread the word amongst your people to do 3 things. Next one, please. And I've made them so easy for you. 1, become a social prescribing champion. So in the UK, we have the National Academy of Social Prescribing. Now we could have a whole conversation about the word prescribing, and I have, and the medicalisation of what nurses have been doing forever, I have. But here's where the power is. The National Association of Social Prescribing is influencing arts and nature and activities in the integrated care boards, in policy, in spaces where we can start to put this other way of knowing, other way of being a nurse into practice. I'm the nurse on the nurse advisory board, and if I could get nurses, if I could get 1,000 nurses to be social prescribing champions, we can create a bit more of a critical mass so that this isn't having a biomedical lens on it, where social prescribers are being told to send people to social and artful stuff without that relational element that goes with it. Next slide, please. So within these slides, I've given you all of the links about how to do it and the website links, and there's nothing stopping you other than why bother. So I hope if you were standing in that tide and got knocked over by the wash from the ferry, or couldn't breathe in Cabway, or were told nurses are, or in the middle of an ocean somebody treated you unfairly, you'd be joining up, and I'm sure something in your life has made you a little bit irritated. So please join to become a social prescribing champion, and we can actually shift this way that nurses are being viewed and being listened to as well. Next slide, please. My next invite to you is to write 500 words, that's all. And it's about your experience. Nothing nerdy, doesn't need a competency framework or any kind of diagram. It's just 500 words that's based on your experience, a piece from the heart where a relational aspect from you of being a nurse linked to sustainability could make a difference to some other people. And this is in partnership with Johns Hopkins University. You might have heard of them if you're in public health. And they tweet these 500 word stories every day. And they're saying to me, if I could get more nurses onto this platform, then we will shift how people see nurses, but also how people see sustainability within nursing. And my story will be out at the end of this week. It's not about sustainability, it's about mental health, because I'm a mental health nurse, and much of my work is about challenging stigma within mental health and the status of mental health nurses. And it's very easy to write, and you just send it to them and they do all the permission element, and they come back and they say, is this all right? And they put a little picture on it, and suddenly you've got your story out there. They have Twitter followers, email subscribers. It's US based, but imagine if we could get this kind of build up of small stories of nurses doing sustainable work about sustainability and stigma work and stereotype work. We could actually shift this critical mass of what people think about what nurses do and what nurses could do. Final one, please. The top tips are there because I wanted you to be able to see them as I went away, and they leave a short takeaway message so that people who are just scrolling can suddenly scroll through a sense story, a nurse story with sense and sensibility within it. So you'll have these slides. So at least everyone listening here do one. If not, get 10 people to do it as well. 10 nurses, let's raise our voice. Next one, please. So what I've done is given you some information and maybe some motivation about using the arts to take forward how nurses are seen, heard, and what we do. I have webinars, they're ArtofNursing webinars, they're hosted by the RCN, and the next one in November is about gender equity in nursing, using Paula Rigo's work and with a drama company called Scary Little Girls about queen ages, because there's nothing like calling menopausal women queen ages to get things changed in how we see the world. Art in Action in January, that's about arts in conflict zones, Red Noses research, but also the Reading Agency about books and art and action in schools in the UK. Musical Notes on Nursing in April, and then in sort of March, then Making Art Part of Health with Michael Rosen and others in April. And fingers crossed, I've got an exhibition and an art competition that'll all come together in May. I just haven't got it all together yet. But this kind of raising the voice and raising the views of nurses through the arts is one way that we can actually start to run in parallel with the artificial intelligence that's working to automate and augment nursing in a different way. So final one, please. So if you don't think that this is for you, that's okay. The way that we start to integrate how we work in nature and with nature and therefore through the arts is going to be different for everybody. But for me, this presentation with you is part of the United Nations Festival for the Future, which is joining rebel artists together across the world to speak up against the issues that are going on that undo equity, access to care, water, all the SDGs together. And my story, Tiny Rainbow's birthday, was born out of the sea and written about women sailing across the Atlantic, and it's just a story that needed to be told. I am so anxious about it, but if we don't do this, then actually we may as well end up with the Don't Bother Brigade. So it's your choice now. Can nursing be about nursing people and the planet? Should we bother? And I think if we don't bother, then we can only got ourselves to blame and we'll be a semi-professional. If we do bother, we'll be a profession for the 21st century, and we'll have a planet and equity that other people will want to be in, and the next generation will be proud of us. Thank you. Any questions?
Thank you, Marion. That was amazing. I was already expecting wonderful things, but I think you've kind of surpassed that. So thank you very much. Can I open up the floor to anybody with questions? We've got a few nice comments in the chat here, Marion. I don't know if you can see these. Maggie.
I'm in too much of a state to see them. Maggie, what do you say?
You don't look like you're in a state. You look very, very calm and just very passionate about what you're saying. So Maggie Woods has said, fantastic thought-provoking session. Thanks, Marion. I wish I could stay. Alexandra Anderson, as she had to leave, and Lucy's thanked you very much for sharing your story, your expertise and your powerful insights. What a pleasure to have you with us today. Unfortunately, she has another call, so a few people have had to leave, but I can see a few hands up. So Mark, do you want to kick off?
Yeah, sorry. Marion, fantastic presentation. My one feedback is, whilst this is delivered by, and it's mainly female orientated profession that we work in, there's also men that are really, really passionate about the stuff that you talk about as well. And for me, that it just lost a bit in translation, your passion, because it was female orientated. That is the only thing I'm going to say, because there are men within the profession as well that are passionate about the things that you talk about as well.
Do you have anything, Marion, you want to say in response there?
Yeah. So I am a post-feminist, and the female gaze I take on things is on purpose, because the usual sense of the world is the male gaze. So women are always othered, and so through society that's always been the state. And you noticing that is good for me, because you've just noticed that parallel world exists, where what I've said you've noticed, and in many spaces when things are being said, women are trying to say, but women are interested in this as well. So the duality is crucial. That's why I want to call it parallel, not power. And the elements from Global Health 50/50, which is all about gender parity. It's not women gender parity and men gender parity. It's about recognizing the benefits within each, and actually making sure that there's a balance all the time. There needs to be positive action in some ways because of the dominant discourses that go on, and we're seeing those in a white male Western medical trope that influences much of the decision making that we're going on. So thank you for saying that. It's on purpose, and you noticed it. Other people might have felt it was, I was speaking with them, and for them, on behalf of them, because of other inequities that happen with strength of voice. Anyone else?
You're on mute, Mark. Did you want to? I wasn't sure. No. Are you quite? Oh, I can see in your in the chat there. Thank you. I appreciate your thoughts. Has come from Mark in the chat. Michelle.
Hi, Marion. Can you hear me?
I can.
Hi. Thanks so much for that. I loved it. I love listening to you. So innovative and passionate. I teach global health and sustainable healthcare to the nursing students at Glasgow University, and I was wondering about that 500 words piece, the 500 words that you were talking about, trying to encourage nurses to submit. And I was wondering whether or not you would welcome any kind of pieces from the nursing students about what they're learning about sustainability and global health.
So here's the post-feminist stance with it. Let's not wait for permission, praise, or pay. Just do it.
Okay.
I'm not the filter here. Closer will send it in. Gretchen, who is coordinating them at the moment, then decide. It's got around a 2-3 week wait time. So these written bits, if they don't get in on there, it's already part of a reflection, and it gets past the anxiety element of who am I to say, who am I to write. Don't just get them in and build it into a narrative. That would be amazing. Yeah.
Perfect. Thank you for the guidance.
Thanks, Michelle. David, would you like to pose your question?
Hi, Marion. I'm David. I work on sustainable practices for Doctors Without Borders, and I found your talk really inspiring. And I don't know if fractals image are supposed to make you feel calmer, but your voice definitely does. And it was really a smooth presentation from my side. I just want to say that it resonates a lot with what I'm living inside my organization. We look a lot about carbon and talk about global, but when we look at what speaks to people, it's plastic, it's air pollution, it's PFAS. So there are many other aspects that we should take care of, and this dichotomy, these two sides, I find them really interesting, and the example of the paintings and the picture that you showed made me think of a painter from Berlin that I really appreciate, and I actually have it at home. I'm going to put it in the chat because I think you might appreciate it as well. And it really shows these two sides of nature and civilization, and yeah. So no question from my side, just appreciation.
Thank you. And giving me pictures is a gift. Anybody want an argument?
Does anybody else have any?
Whether social justice is part, I suppose I'm speaking to the converted here, aren't I? Is social justice and this activity part of nursing or not part of nursing? Should we just be, doing stuff to people, or is this our world? I'm interested in a man, because I know the Queen's Nursing Institute have the gardens, but also Amanda and I have sort of spoken on other things as well, haven't we, Amanda? And I'm my call to action now really is how do we integrate, because I'm from the Foundation of Nursing Studies and working on this sort of arts work, how can we somehow build this critical mass of nurses' voices that shifts the tide of what nurses should and shouldn't be doing in terms of not just nursing people, but nursing the planet. Amanda, have you got any?
Oh, yeah, now we have the garden projects. It's really, it's just bashing away the whole time, getting the message across. And I think that Michelle mentioned about pre-registration. It's just not that when I was a pre-registration lecturer 5 years ago, it wasn't anywhere near the curriculum at all. It was vaguely mentioned. And obviously since COVID, things have changed within the organisations. And I think the work that the centre are doing and the new programme that I'll be helping with Anna's running will hopefully get that voice out there for nurses. But I think it's really hard. Keep going on and on about it. Every opportunity.
So we build it, yeah. As Marion said, we go again. So we build it, and each time, just like with a rising, it's the next wave is a bit bigger and a bit bigger and a bit bigger. I think this energy behind it, with more stories to closer, more social prescribing champions within that medical model, ecological literacy in the curricula somehow. I want to be the art side of that. So if anybody wants me in their conversations or wants to be in the special interest group for creative health with nurses and creative health, part of an exhibition, a competition, all these things that are starting to emerge, keep me in the loop, because this is the only way it's going to happen is if we stop waiting for permission and start just taking that space as men and women who are wanting to actually change how nurses are and are part of the world. Anna, I've got you. Oh, sorry, Angela, I've just taken over. I just realised.
No, it's fine. Go ahead. Yeah, Anna.
Thank you. Well, super interesting presentation. I love your combination of arts and nursing. I think there's so much in there to, make people more passionate about, or make people understand the passion about the work that we're doing. And something that, what you're talking about resonated so much with me, because I've just recently had a conversation with somebody else, with Aisha Holloway here in Scotland, who called it "Nurses Are Too Nursey." And we're being kind of locked into this little box of being the nice little nurse who is helping the doctor. But nursing is so much more and can be so much more. And when I got my degree, I remember I kind of took it as I'm now allowed to question everything and everyone. And I went out there and made a lot of mess. But I think this is such an important discussion to have, this allowing people, giving people the feeling that they're allowed to step out of this very small box that we're sometimes put in and see the wider impacts on our patients, on our profession, of this kind of environmental issues. And I guess it's not so much of a question, Marion, but more of an invitation that maybe we should have a chat at some point, because it would be absolutely amazing to include your art into the courses that I'm running for CSH, and maybe include you as a facilitator if you're interested in that as well. So maybe after this we could have a little chat at some point, or organize one. I'll send you an email if that's okay.
Do please. And I'm on the Green Nurse Challenge stuff, so Angela's got it all, so I'm integrated into your organisation in a sort of nebulous way already. And isn't it interesting, Anna, because I wonder if a male nurse would have the same vista on being too nursey and contained, because I'm sure, you know, Mark's comments at the beginning about the lens that we use on this and on nursing has always got a gender element to it as well. And we see that with nurse leadership that's happened in the past sort of 10, 20 years of women potentially waiting for permission to get out of that box, and male nurses either never feeling they were in that box or being spat out of that box by the women because they're not nursey enough. Yeah, too male to care. So, you know, has to go to the management meeting, because there's parallel situations that have created the situation in nursing. Women nurses have promoted men into positions of power, and men have gone into positions of power. It's so interesting when you try and look at that in stories through the arts, that people don't necessarily then take umbrage with it, or start to see things in a different way as well. So, and that's part of the art. You know, where's the 90% of women, and what is it that men hold dear that enables them to become allies, so that they're able to share this power space in all of the spaces of the world as well. You can do that through the arts in a far better way than a PowerPoint.
It's an interesting discussion, feminism and nursing. I feel like it's often we focus on how it is limiting to the women, but I think it's also limiting to men, especially in nursing. When I saw my colleagues being disregarded in a way as being less good of a nurse because they're male, and me coming from neonatal intensive care, where it was like, oh, of course you're not as good with the babies because you're a man. I feel like there's both sides have a negative impact, and this kind of gender stereotyping is just generally a problem.
And that's what I say about parallel worlds. And we're speaking on behalf of men now, and there are men in the room. But nursing spits out men as well as promotes men, just as nursing crushes women as well as promotes women. What is it? So our 21st century, how do we make that visible through the arts? And I've got plays that are starting to show that in a different way, because you can create a kind of story of, oh my goodness, that was me, through an arts way, a one step removed way that doesn't feel so pejorative that an EDI policy might feel. That's why the arts are exciting. So yes, we're here to entertain, educate, and shake it up, as you can see.
Oh, sorry, Marion, sorry.
I feel I've taken the whole meeting, and I don't know if I was supposed to.
No, it's absolutely fine. I think Anna's got another question for you though, Marion, if you're happy to
Yeah.
hang on.
Yeah, that was very, I mean, yeah, it was a really great presentation and really thought-provoking, and it's just interesting talking about, yeah, I know it's been highlighted, genders particularly, but I guess it's also so many levels of intersectionality that also impacts all the things that we talk about, and just thinking about how do you think that sometimes these debates of intersectionality, are they promoting and making us go forwards in kind of trying to change the planet, or do you think that sometimes these debates in between may also sometimes take away from the common goal that we are having in terms of planetary health?
So again, it's the parallel, isn't it? There's free speech in its ethical and philosophical way is always good, because that creates new innovations and new ideas. But too much talk and no action is just talk. So actually, again, it's the parallel conversation. For what purpose? Is it philosophical, in which case we grow ideas? Is it to grow oxygen and safe space and other tides? But I think we need both all of the time. And that brings me back to the picture. I'm looking at the picture David put up in the paper, where I see a person in shadow in a sort of a urban space. I was trying to think, what's the word? Urban space with a rural slash through it of the animal, and that's the balance that we need each time. The conversation that actually keeps progress happening in that urban space with the electricity and the lights on, but does something else about that calmness and the utility that we need from nature as well. Not just the emancipation of all of this, but how nature will help us live in the future. And as nurses, how do we balance? There are so many images and art pieces that talk about this, but even down the gender one, I can say, art to address gender and the planet. There's a beautiful picture of a wedding cake, but it's made out of all the injectables for fertility. So that's men and women, because the woman, isn't able to have the baby for men and women's reasons, but all the injections are made into this beautiful wedding cake because none of them are disposable. So all of this work, and about wedding being the best day of your life there, but a family wanting children, and all these injectables. It's just such a conversation piece to go, oh my goodness, what is that? Oh my God, it's full of injectables to have a baby, and it's a wedding cake. And that then doesn't mean either gender is better. The agenda is actually, what are we doing when we're trying to make more babies to the planet here as well.
Okay, on that note, we've got a minute left of the meeting. I'd like to just draw it to a close and thank Marion for a really, really interesting and a refreshing look on a subject that is all close to our hearts. Thank you so much, Marion. It was I really, really enjoyed it. Thank you ever so much for giving up your time to join us. Next month we have Giovanna Di Candia. Have I spelt that right, Anna? Pronounce that right?
Yeah.
Talking about plant-based health professionals. So we'd love to have you join us next month. Spread us far and wide. We'd like to always recruit new people. So yes, thank you very much for joining us today, and hopefully we'll see everybody next time round.